This podcast is for entertainment purposes only and does not substitute for professional medical advice. Please seek a medical professional or healthcare provider if you're seeking any medical advice, diagnosis, or treatment. Thanks, everyone. Hello.
Hi.
Every single time we come to record, we have the worst IT issues, but thank you, ChatGPT, for being our personal IT person.
And that's what I spend the night, an hour before every night,
There's always
setting up
something.
everything. But on the moment that I'm turning everything on, and like for the dumbest thing, that's all it
And at the end of the day, Chat didn't even help. We figured it out. Anyways. Okay, today's episode is a very good one. There's so much good news on this topic in general.
I'm Julie.
Oh yeah, sorry. I'm Yvy. And we are Funny Medicine. And today we're going to be talking about RSV. This is what I wanted to talk about.
And if you didn't know, if you're tuning in for the first time, she's a board certified pediatrician. So this is her.
This is a little bit of a niche for me.
Yeah.
Not really a niche. It's not like I'm doing like active research in RSV. But I have this conversation every single day.
Yeah.
So yes, I'm happy to be talking about RSV.
This is a common thing for you, especially now in flu season and cold season, sniffle season, and all that.
Yes, RSV is
all
huge.
That great
it's always
stuff.
the same thing. It's like RSV, COVID, flu.
Awesome.
Yeah, well, along with other ones, but yes, RSV is one that, we'll get into it.
So let's do it.
All right. So what is RSV? So respiratory syncytial virus. It is a common respiratory virus that infects the nose, throat, and the lungs. And in most healthy people, it causes, the typical mild cold symptoms. RSV often sends babies and older adults into the hospital. Why? Because they have a little bit of a weaker immune system. So it is the leading cause of infant hospitalizations in the U.S. every year, which I don't think a lot of people know that. RSV belongs to the Pneumoviridae family, and it's basically an offshoot of the Paramyxoviridae family. And it is a group of enveloped negative sense RNA viruses. It comes to two main subtypes, an RSV-A, RSV-B. The virus earned its name because infected cells fuse into giant syncytia in the lab. But for most of us, it causes the RSV typical symptoms, the runny nose, the cough. It's highly contagious, spreads in the fall and in the winter, in temperate climates, and typically peaks around December to January season. And Florida is actually, RSV does have its seasons. That's why a lot of vaccinations are pushed during this time. But what a lot of people don't know is that Florida is year round. Yeah. It's like for us, like we don't really have that season. It's year round, so we actually recommend the vaccine year round.
We just don't have seasons, period, and that's the thing.
Seasons, so just give it all year long.
Our fall is that it's 80 degrees now.
Yeah,
that's our fall, and I'm actually so happy about it. It's not like
this
high
weekend
90s.
was, I feel, the first weekend that we had a fall type weather.
The fact that I wasn't sweating in Halloween, I was very happy.
I was actually telling Mike, I was saying everyone must be so happy this Halloween because no one is sweating in their costumes. It was beautiful weather. It felt like Halloween.
Yeah.
Like a gloomy fall overcast day, and it was like windy at nighttime. I loved it.
Delicious.
Yeah. So again, almost all children have been infected by RSV. That's another thing that I tend to see that's a common misconception is RSV can infect anyone. But again, our highly vulnerable populations are going to be babies and elderly. So again, almost all children have been infected by RSV, and it's sometimes they're even already infected by their second birthday. So it's really not a long time.
Yeah. What were you in Halloween?
I didn't have a costume. I was supposed to be one of the K-pop demon hunters with Nora, which I did not know that there's like so much.
It's huge.
No. I know it's huge.
Yeah.
But I didn't know how it's actually very split. There's a lot of parents I'm in this group that feel that the movie, because it has K-pop demon hunters, so there's this group of people that are like, it's really not that bad. The movie's actually not like demons. It is, but if you just read the name, you're like, maybe my kid shouldn't watch that. Right. But then there's like the families that are like that they're like, hell no, I'm not letting them like watch this movie. Each their own. I really don't know.
If you see my posts of recent for Halloween, I was left a note by a Karen, so you know how I feel about that.
Yeah. People have problems with Easter, with the bunny and all that stuff. It's Easter. Everyone has their thing.
Easter is like the fucking Sunday after I don't know how many moons or whatever the fuck. If that doesn't scream like, shut the, like, ugh. When I said there in that thing, I'm like, if you could have just taken like the amount of time that it took you to write this paper and then to come to my house and leave it in my wreath to like really research everything that you're like saying here, then maybe it would have been a better use of your time, I think.
I think it all depends on everyone's personalities. Even if I did have such a strong view on something, like I really like wouldn't walk up to someone's doorstep and like,
what the fuck is that?
Yeah,
that's what I'm saying. Like, how
really
bored
weird to me. Yeah,
how bored are you with life?
I don't think it's bored. I think it's weird. I think it's weird that, but whatever. You know, there's a person on this earth for everything. So
okay, yeah, exactly. So you weren't anything for Halloween. Long and short of it.
No, yeah. Long story short, I literally had a Disney villain. I have a T-shirt that's like the Disney villains.
Yeah.
All of them, and that's what it was. I think it's actually funny that you just said that. But anyways, I mean, what can I tell you? But yes, I was supposed to be the K-pop demon hunters, like one of them with Nora, because she was runny for Halloween. She was so cute.
Yeah.
But yeah, I didn't know. It was like, it's very polarizing to people. There's some people that are like, hell no. And then there's people like me that I'm like, I feel like she sees worse in this world.
That's the thing. It's
again, like, man, like if you show your kids K-pop demon hunters, great. If you don't, great.
I was singing.
I feel like if Nora's able to watch The Nightmare Before Christmas, K-pop demon hunters, I think is less scary for sure.
Absolutely. And in middle school, the rock music we were listening to.
Yeah.
Come on.
Yeah.
Like just like that. My neck, my back.
Yeah. True. I'm like, true. But also, you know, I show her like other things but you know, like Lady Gaga.
Yeah.
Right?
Yeah.
I'm positive there's someone out there.
100%.
That's like this girl's crazy, you know?
There's millions of them. Yeah, of course.
And we love Lady Gaga. We play her all the time. We dance to her all the time. But I'm sure that there's someone out there that is crazy.
There are people out there that are against Disney because they're representing now LGBTQ plus whatever that community that they're representing in their movies. And there's people staunchly against it. I'm like, can we chill?
Yeah. Everyone
like,
needs to take
wrong
a
with
deep
you?
breath. But anyway, back to RSV. Okay, Julz, you're going to do the history.
Yeah, all right. So let's talk a little bit about what it is, because obviously RSV is definitely not new. It was first identified in 1956, and researchers in Robert Channick's lab at the U.S. National Institutes of Health isolated the virus from children with respiratory illnesses and linked it to what had been called chimpanzee coryza. Oh, like coryza.
Yeah, exactly.
Let's say in Spanish. Okay.
Coryza is that, coryza. Runny nose.
Runny nose, yeah. Cold virus. Soon it was clear that the same virus made human babies sick. Those early lab cultures showed that the fusion effect that gave RSV its name was that, I guess. Over the following decades, scientists learned RSV is divided into two genetic groups, A and B, and how it spreads and causes disease. Only in the last few years have effective preventative products, vaccines, and long-acting antibodies become available. So yeah, it's been around for forever.
Yeah, and we're gonna jump into the symptoms, but it can cause some
nasty stuff.
Yeah. RSV spreads. We're going to talk about now how it spreads and why in this season, but RSV spreads easily through close contact. So it moves from person to person via respiratory droplets, from coughing or sneezing, or even by touching some contaminated surface. Your hand land on something that picks up the virus. Again, I can't tell you how many times I say you need to wash your hands. And the reason why we say wash our hands because we put our hands on our face so much and people don't notice how much you actually touch your face or your neck or your head or something where you like touch food or something that you're going to eat. Washing your hands is so important. But again, almost everyone catches RSV at some point, and the virus can live for hours on hard surfaces or on unwashed hands. Shared toys for those kids in daycares and at school.
Huge.
Yes. Or kissing babies. It can also pass that along. RSV infections rise in the fall and in the winter months along with other respiratory viruses. And in most of the continental US, the season begins in fall around September, November, and peaks in the winter, often late December through February. Some states like Florida have longer or earlier RSV seasons. Again, kind of like how we just said, it's kind of just year round. And in tropical climates, RSV can circulate year round and have different patterns. Because RSV is so transmissible, it can cause seasonal waves of illnesses in the communities. After COVID or the COVID era, social distancing ended. Many countries saw unusually early or high peaks of RSV in 2021 to 2023. So let's talk a little bit about preventing spread to reduce this RSV transmission. This basically you use standard precautions. So washing your hands often, avoid close contact with sick individuals, clean toys, the surfaces, cover your mouth when you're coughing or sneezing.
Yeah.
And also just try not to do this.
Because then
Just try to use this.
the vampire.
Yeah, the vampire. Again, so clean the toys, surfaces, cover your coughs, your sneezes, keep young infants away from sick people and crowds and anyone with a cold or symptoms. That's why every single time someone tells me that they're going to travel with such a young baby, I'm just like thinking of that airplane and all the circulated air in there.
Not good.
But anyways, these steps that we just mentioned will help. Because RSV is so common, we also now have medical preventatives, monoclonal antibodies, and vaccines that we're going to talk about in a little bit. Why RSV seasons, environmental factors like temperature and humidity have an effect. RSV tends to thrive in cooler, drier air, which is why in most of the US it peaks in late fall and in winter. Dry winter air helps the virus particles stay airborne longer and survive on the surfaces. Lab studies actually show that RSV is less stable in hot, humid conditions, which explains why it's less common in the summer. Human behavior in winter also has an effect. Why? In the colder months, people spend more time indoors and in close contact, right? So, our holiday seasons, we're all getting together. I cannot tell you, every single year, I got sick after Thanksgiving or I got sick after Christmas. And then New Year's comes along and I'm like deathly ill.
I was just going to say that. Almost every 31st in the last 5 years, I'm sick.
Yeah, you're sick.
And it depends on the level of sick, but I'm sick.
Yeah.
There was one year that I was like the dare commercial.
The dare, yeah.
I was like that, like, okay, cool.
waiting till midnight.
Exactly. Horrible. Last year, the same thing. I had to like dose up on Dayquil to make it through. Like, it was every year, man.
There was
31st.
after COVID, there was like 3 years that my family was sick with COVID for New Year's.
I'm not surprised.
Yeah.
I'm telling you.
This is ideal for a virus that transmits through droplets and touch. If you're in close contact, close quarters, and you're indoors, that's why we see it so much. Schools, daycare centers are also amplifying the spread as well. And your immune system is also going to have this seasonality. Immune defenses can be slightly less effective in the winter. Shorter days means less sunlight exposure and also lower vitamin D levels, which may influence the susceptibility to respiratory infections. So again, it's not something that's like for sure that your immune system drops. I don't want people to take that out of context and be like, oh my God, but
like our parents,
yes,
Cubans,
exactly.
It's like, oh my God, it's cold.
It's cold. Put on a sweater, But anyways, we're going to talk a little bit now about the virus host dynamics. So after an outbreak, many people in the community are immune for a while. Immunity to RSV is incomplete and short-lived. By the next season, enough people or babies that are brand new to the world are susceptible again. That's basically going to set up another wave. Geography matters as well. In temperate climates in the US and in Europe, RSV peaks in the late fall and in the winter. In tropical climates, RSV may peak during the rainy season instead of the winter because of the humidity and the indoor crowding during rains favoring that spread.
Yeah, everybody's like avoiding
the rain, exactly. In some areas like Florida, RSV can circulate year round, but still it does have its seasonal surges. I can't tell you how many times I see all of this during the winter. But again, I see this with everything though, like COVID, flu. I see flu all the time in the summers too.
I feel like the biggest piece that I see from like a non-professional, just like having a kid at home, is like first months of school immediately. Like that is, especially the first 2 weeks, immediate. There's some cold of some sort. And then like during winter on the 31st. And then I see it again when they go back to school after winter recess. Like those are the little peaks that I see throughout the year. It's like,
have you seen the TikTok videos of like parents happy that they're sending their kids to school again after break
all the time,
and then they come back with like the sniffles and they're like, no.
Exactly.
Not again.
Yes. Yes. Or it's like they're doing like a fashion walk and it's somebody like with a ridiculous like looking like high fashion thing
costume.
That it looks
I know.
And it's
I know
like my kid walking in with the latest
the latest virus. Exactly.
I saw that I died. I'm like, that's exactly
it. So putting it simply, RSV is not a winter-only virus, but winter creates the perfect setup for it. The virus survives better when we gather indoors. Kids share germs at schools, and together that just makes RSV surge at the same time each year. That's why we talk about it all the time during these winter and fall months.
Yeah. All right, so let's talk a little bit about the symptoms of this RSV infection. RSV typically causes symptoms like a cold, okay? In older children and in healthy adults, infection often looks like a mild respiratory illness. Common signs appear about 4 to 6 days after exposure, and they may include a runny nose or a stuffy nose. A clear nasal discharge is usually first. Then also congestion, swelling of the nasal passages. Also decrease in appetite, which drives Cuban moms nuts. And then the anxiety goes up, and then I get annoyed, and the anxiety, and then it's fine, you're not gonna starve. It's part of the cold.
This is a daily conversation that I have too.
Yeah, if you're Hispanic or anything like that, we're Cuban background, anyway.
Drives a grandma crazy when they don't eat.
Oh my god, it's the anxiety is like all-time high. Anyway,
especially El niño no ha comido. El niño, Julia.
Oh my god, it's just like he's gonna be fine. I promise you, he's gonna be fine. He will survive.
But I see it in clinic too. Like every time I'm just like, look, it's really okay if they're not eating a crazy amount of solids. Just focus on the hydration. The parents are just like, but they haven't eaten anything. And then I'm like, I know you're concerned. I get it. But they're gonna be okay. They didn't have 3 croquetas. They had half. It's okay. You should actually give them some more. The water here is the important hydration, electrolytes. That's actually why like we recommend, like soup and stuff like that, because it's a lot of liquids, blah, blah, blah. But yeah.
So obviously you also see some coughing and sneezing as the infection moves into the airways, all of that. Fever, often low grade. Some infants may not even run a fever. Then there's wheezing or noisy breathing. If the lower airway is involved, then you're going to kind of hear that. Irritability or more sleep than usual. I mean, think about it. When you have a cold, you just want to be in bed. That you're going to see that with children as well.
And kids are also very congested. And when these smaller kids, they can't really eliminate, they don't have a strong cough. Like for an adult, if you feel you need to get something out, you can forcefully cough. Kids don't really have that. So the cough that they have is kind of that just innate cough to get something out, but it's really not a good cough.
Right.
Which is why we worry a lot about children with maybe neuromuscular disorders because they can't get that out, right?
That makes sense.
Or children that may have some cerebral palsy or something like, again, they really cannot create that good cough.
Yeah.
And they are so uncomfortable. These kids are so uncomfortable because at nighttime they're so congested. They also can't blow their nose. It's up to parents to really like flush them with the nasal saline, suction, all those things. And sometimes at the hospital, all we do is just good suction.
Yeah.
There's really not, yes, obviously, just depending on the case, right?
Right.
But if there's no lower airway complication and it's really just all up here, sometimes it just takes really good suction.
Yeah.
And sometimes parents will go to the ED and they're like, it's crazy how many boogers they got out just with the suction.
Yeah.
Everyone needs a nose Frida. Everyone.
Oh, yeah. I remember using that a lot.
Yeah. Everyone needs it.
It was incredible. I know it looks weird and it looks like it's gross, but you're not going to get anything in your mouth. I promise you're not. The amount that comes out.
Yeah.
That was
It's
one of the
impressive.
best inventions ever.
Yeah, it's pretty
thank you,
impressive.
Frida.
Yeah.
All right. So then obviously, like I had said, irritability or more sleep than usual, like we all would want to, especially in babies who feel unwell. These symptoms usually develop gradually in stages, not all at once. For example, a child might start with a runny nose and fever and days later begin coughing or wheezing. Most people recover in about a week or two just with home care, just taking it easy.
All right. So this is what I hate. Not the runny nose and the cough.
Yeah.
But
This is
what
where it
it
gets
can cause.
Saucy.
Yes, the severe RSV illnesses.
Oh, boy.
In some cases, RSV can actually turn into something incredibly serious, especially when it travels into your lungs. And imagine that illness in something so little as a baby or an older person or an immunocompromised person.
I was going to say that.
So RSV is the #1 cause of bronchiolitis and pneumonia in infants. Bronchiolitis means that these tiny, tiny little airways in the lungs become inflamed and filled with mucus. When this happens, babies and toddlers may wheeze. They may breathe rapidly. They can also have grunting. If you hear grunting, you better be running to see a doctor. They can become very fussy since they can't breathe correctly. They can't feed correctly. And again, we're talking about your body is fighting an infection. Your metabolism is kind of like burning right now. And if they're not feeding, they're not hydrating. It's kind of like this like vicious circle. It's like poor hydration. You're even more dehydrated because you're still fighting this infection. You're actually wasting and burning a lot of calories with this extra breathing that you need to do as well. This is where it kind of can get very, very severe for infants. Again, their oxygen may even go down and they even have this like kind of bluish color. Very young infants under 6 months are at the greatest risk, and sometimes their only signs are kind of subtle irritability, maybe sleeping more, not eating well, not so much congestion, but sometimes just like breathing very, very fast. And the parents are like, well, that's kind of weird. Why are they breathing so fast for so long? And again, these are all very like small symptoms, but that can mean that there is lower respiratory pathology going on. Adults can also get lower respiratory disease from RSV, though it is more common in people over 60 or those with chronic conditions. In older or immunocompromised adults, RSV can cause a cough, high fever, severe breathing, problems that resemble maybe something like a flu infection or a COVID infection. The FDA actually notes that each year, the US RSV causes tens of thousands of hospitalizations and thousands of losses of life in older adults. If RSV causes severe lung infections, patients may need hospitalizations. Doctors can also give extra oxygen, IV fluids, and place breathing tubes if needed. We're talking about the most severe complications when your body decompensates and you really need an intubation to support your steady like gas exchange or your breathing, aka. Even serious cases often improve within a few days with some supportive care, but again, it's that risk, right, that you're taking. You really never know how like that's going to evolve
Exactly.
from patient to patient. Who is at risk? Again, almost everyone can get this infection, but risk of severe illness is going to vary. But the most vulnerable populations are infants and young children, particularly those under 1 year of age, premature babies, or those with congenital heart disease or chronic lung disease, face an even higher risk. That's why these are the babies that we push more for the vaccines that we have. Now, the American Academy of Pediatrics estimates that about 1 to 3% of US infants under 12 months are hospitalized with RSV each year. Older adults, people over the age of 65, are also more likely to have complications. Adults 50 and older with heart or lung conditions and those with weakened immunities face a higher risk as well. People with chronic illnesses, so for example, children and adults with asthma, cystic fibrosis, neuromuscular disease, or even suppressed immune systems, those are going to be the higher risk populations. Members of closed communities, RSV spreads easily through daycare centers, nursing homes, and we always forget nursing homes.
Yeah.
And hospitals caused by outbreaks. All infants, nearly all infants, get RSV by age 2. Think about that. That's crazy.
Yeah,
Okay.
that's how common it is.
Yeah. And again, sometimes you don't know, right? Because
Yeah.
we're not specifically testing for RSV, right? There are some clinics that have the rapid, the rapid test for RSV. But again, that's sometimes expensive for a clinic and they can't really like fit that into their budget. So they just don't have it. Again, like if a baby presents with bronchiolitis, you're like, well, it's most likely RSV. You know, you kind of have to make that clinical decision. But I'm just wondering like how underdiagnosed it is because of those people that do not do the actual testing for it.
Right.
But again, nearly all infants get RSV by age 2. Most infections are mild, but because babies' lungs are very small and still need to develop, even a cold can become very serious. The health experts now recommend RSV prevention for all babies. I mean, we're really trying to start this just by them like leaving the hospital. They should already be vaccinated. Risk factors increase the chance of hospitalizations. Globally, RSV is a leading cause of infant loss and infant loss of life, and that's can be seen in low-income countries where supportive care may be limited. In the US, annual RSV burden before vaccines and antibodies was large, roughly 2.1 million outpatient visits among kids under the age of 5, and about 58,000 to 80,000 pediatric hospitalizations each year. That is a lot. That's a lot of kids with RSV.
Yeah.
You know, I remember, so I kind of have like a weird perspective with COVID because remember, I started my residency as an intern in 2018 and then I finished in 2021.
Yeah.
Right.
Yeah.
So I was like kind of started and then by my end of my second year of residency, that's when the whole entire COVID started hitting. So then as a senior, I did a lot of COVID. But we never, like during winter and fall for us was like, get ready.
Oh, yeah.
Everyone had bronchiolitis.
Yeah.
Everyone in the wards had bronchiolitis. And then during COVID, we just didn't see it, to the point that I remember being as a senior talking to my other co-seniors. We were saying how our interns weren't really getting the exposure that they needed to be able to learn. They obviously knew we still had kids coming and getting sick, but not even remotely the volume that we saw. Because again, people started social distancing, not really going out. So we did see a natural drop in all of these. Like we didn't get our asthma crises that we used to get, like our bronchiolitis, all these things. It was crazy. And I remember talking to my attendings and to see the difference in the drop in hospitalizations just because people were social distancing and washing their hands and being so careful.
Yeah. COVID did like so much.
It was that perspective that I have, like very, how can I say, like everything happens for a reason. So I'm happy I was able to see that before and that after.
Yeah.
But again, like it's crazy to see that difference of how effective social distancing can be, or just hand washing in general, maybe wearing masks, like just everyone being extra cautious about making sure things are clean, surfaces are clean. Like, don't you remember people washing their groceries?
Yeah. Yeah.
So
Yeah.
again, anyways, back to RSV. Among adults 50 and older, RSV causes 110,000 to 180,000 hospitalizations annually. And the CDC and FDA data estimates RSV causes about 60,000 to about 120,000 hospitalizations and 6,000 to 10,000 losses of life each year of US seniors age 65 and older. So sad.
Yeah.
That's a lot of,
A lot.
those numbers are a lot. We have these preventative measures now. We have these immunizations, which we're going to talk a little bit later into the episode. But yeah, Julz is going to talk more about the diagnosis of RSV.
All right. So how do you diagnose this? Because the symptoms are so similar to so many
Like
other
everything.
things.
I mean, if you've really been listening to all our episodes, like how many times have we said flu-like symptoms? Everything
Pretty much.
is,
Yeah.
you
And
know,
this is just another one
fever,
of those.
this, exactly.
RSV symptoms look like many other viruses. Doctors often diagnose based on clinical signs during RSV season. In young children with severe illness, a nasal swab test can detect RSV. Many clinics have rapid RSV test or PCR panels that check for multiple viruses, which is what Yvy had talked about in the last section. These tests help hospitals know if a cough is RSV or if it's something else that they need to look for. For public health, cases of RSV are tracked through surveillance systems like the CDC's NREVSS and RSV-Net. These systems show when RSV activity rises so hospitals can prepare for it.
And this all depends on reporting, right?
Exactly.
Just take that into account. If no one is really reporting, then you're not going to see that. But again, any kind of reporting, right? Any kind of reporting, we're gonna be like, oh,
And
that's a
it's
change from the baseline. Yeah.
And it's important because then how I said, like hospitals can prepare, so they need to get more equipment, more tests, more people on board, make sure the schedules are aligned, all those things they need to prepare for this, for full ERs and, all that type of situation, unfortunately.
All right, so treatment and care. Unfortunately, there's really no specific cure or antiviral drug that reliably clears RSV. So
At least not right now.
Not right now, yes. Treatment is supportive and symptomatic. Most people recover at home with rest and fluids. Basic care steps is, relieve your fevers. If you have any pain, you can use these medications or over-the-counters to tackle that. Use acetaminophen, ibuprofen as directed. Never give aspirin to any kids. We mentioned this before. What episode did we mention Rye's syndrome? I think it was just recently in varicella.
Probably varicella.
But anyways, the reason why we say no aspirin for children is for Rye's syndrome. Maybe we can even do a little mini-sode on that.
Yeah.
But anyways, staying hydrated is going to be very important. Offer plenty of fluids for infants. Give small, frequent sips instead of, like their normal feeding. Why? Because they're so congested and it can really be a struggle. Imagine trying to eat, breathe at the same time. You're going to cough, you're going to choke, right?
Yeah.
Because you're so congested. So really it's trying to open the airways. Use bulb syringes. I honestly, you can use bulb syringes. Obviously, I know that there are families that do not have any other options but bulb syringe, but really it is just not effective. Really, the nasal suctioning, like we talked about, the nose Frida or like the electrical ones.
It's cleaner too.
We're really trying to create a continuous suction so that we can pull things out. The little bulb suction is very quick, short, doesn't create a lot of pressure to really clear things out. Yeah, it is gross too. Now, keep the head slightly elevated, right? Because when they're more kind of in like a supine position, so laying down flat, when you put them up just a little bit, it just creates a little bit
working with gravity.
Better, yeah, exactly. It's just a little bit of better breathing. Again, just be very careful with elevations and infants, all right? Monitor the breathing as well. If an infant is breathing very fast or struggling or turning blue, I always say, your physical symptoms is going to tell you a lot. You don't need a continuous pulse ox or something to tell you. Like, you can look at a baby and see if that's not normal, right? I always tell parents, I'm like, I don't even need my stethoscope. Just looking at them right now, I can tell that they're in respiratory distress just by signs, right? Retractions, tachypnea, all those things. And trust me, if you see that a baby has a blue hue, I don't need a pulse ox to tell me their oxygen is low, right?
Yeah.
So again, avoid unnecessary medications if you can, right? So over-the-counter cough or cold medicines are not recommended for young children unless a clinician advises them. I'm going to be very honest. I don't like prescribing cough medications,
I think a
right?
lot are like you in that aspect too. I feel like it's dangerous, you know?
Yes, you have a lot of Mucinex and things like that, like on the market for, for kids 2 and older.
Majority of
They
them
just
are
don't
like
work.
4+. I remember that.
Yeah, there's some that are for 2+, and I've seen physicians prescribing cough medications for kids 2 and up. So, but again, it just doesn't work, and you actually have more risk of side effects than you do from actual benefits. So I know, I get it. As a parent, I understand that cough at nighttime, okay?
Yeah.
But again, you can have a terrible sounding cough, but there's always boundaries. But cough is the way that the body expels something out. You really don't want to give them a cough suppressant and pretty much suppress the only way of them getting out a congestion. That is why we really just don't recommend any cough medication under the age of 6. So in rare and severe cases, especially in hospitals, doctors might give some other type of supportive care. So like a humidified oxygen or mechanical ventilation if it is really that severe. So high flow, just trying to keep those lungs open to be able to have a better gas exchange. Gas exchange is just, again,
Breathing.
like breathing. What we need in order to effectively breathe is that exchange, okay? Now, for certain high-risk hospitalized infants, aerosolized ribavirin has been used, but it is super costly and it's not really routine care. I can tell you, I never trained with that. We never used ribavirin, at least me, maybe someone else did.
Yeah.
But care really just focuses on comfort and watching for complications such as dehydration or pneumonia. I think actually what's more common is usually using albuterol. There's a ton of papers showing, some saying that it doesn't work, some saying that it does work. If you have like a positive asthma predictive index, basically like if you have some family history or personal history of wheezing, then maybe you can have some sort of benefit with albuterol. In other countries, they give steroids. Here, we really don't recommend steroids. The treatment management of like supportive care is very different, but no, there is no like antiviral medication right now that we use effectively for like cure RSV.
Like a gold standard type of thing.
Exactly. If symptoms worsen, such as breathing difficulty, you need to go see a clinician. Specifically for babies, I would want to see you if you're retracting, you're breathing faster. Retracting is like what we call belly breathing. The babies are like using their bellies to really take a breath. You'll sometimes see they'll like start having supraclavicular retractions. They'll start having nasal flaring. So you'll actually see their nares flaring outwards. Sometimes you'll hear grunting. So it's kind of like, that is very advanced, right? So they need to have an evaluation quickly. And the thing is that kids crump, right? They literally their body will tire out and they will stop breathing. That's why it's really important to watch out for these signs and symptoms. If your baby is breathing fast, they're having belly breathing or these like nasal flaring, head bobbing, that's another one I didn't mention, but they're like breathing so much that they're head bobbing, then those are really emergent signs that you need to go see a doctor. Now, switching kind of over to RSV in adults, it's managed like a severe flu. So monitoring your oxygen levels, giving you supplemental oxygen in case you need it. If needed, treat secondary bacterial infections, right, with antibiotics. Antibiotics do not treat RSV. I want to make that very clear, okay? If you're receiving antibiotics, it is most likely for a superimposed secondary infection with a bacteria.
So, how do you prevent this? Because it sounds absolutely awful and very common. And just,
It really is awful.
Yeah.
I've seen babies end up on ECMO from RSV. So just look at ECMO. Just Google ECMO and tell me if you're not terrified by those pictures.
I was so terrified of that in the first year of life with my kiddo.
Yeah.
Terrified of of him getting RSV. Because treatment options are limited, prevention is crucial. First line steps are hygiene and infection control. So wash hands often, disinfect surfaces and toys, cover your coughs, vampire style. Keep sick people away from babies, please. None of that like kissing or whatever on the forehead or cheek or whatever. I know it's very common and all that, but
And it's hard, right? Because
hard.
sometimes it's not even like a family member.
Yeah.
Sometimes it's your eldest child coming home
Yeah.
with a runny nose, and you're like,
Stop it.
stop it right now. Yeah. Stop it right now.
Yeah. And like she said, generally just people within the household or out of the household away if they're sick, you know. Medical prevention tools. Say that.
Palivizumab and Synagis.
Awesome. What she said. A monoclonal antibody given monthly. And it's been used since the 1990s to prevent very high risk infants in this case. It is expensive and lasts about a month. Then
Yes, the one that we had before was that one, Synagis. It was like this monthly vaccine that you needed, and usually we would get it. Again, Florida's year-round. Florida kids would get it year-round. Imagine going in for a vaccine every single month.
yeah.
But
you're
again,
also risking, you're also like putting the baby then at risk to going to the clinic and all that stuff.
yes, exactly. But again, the risk for those kids that had chronic heart conditions or pulmonary conditions or premature infants, we're talking about, you know, like a very big benefit compared to risking you having RSV and ending up in the hospital.
Right.
And for the most part, insurances did cover it if you did have like prematurity
Right.
and chronic heart conditions and pulmonary conditions. But as of 2023, we have now, I used to be able to say, but now I always just say Beyfortus, Nirsevimab. Nope, it's Nirsevimab. Yes, Nirsevimab, which is also AKA called Beyfortus. You will hear everyone just saying Beyfortus. And again, it was approved in 2023.
Yeah, so that's great. And why is it great? Because it's a long-acting monoclonal antibody given as a single dose before or during RSV season, unlike what she had said that the other one was every month.
Yes.
Which obviously would then incur more risk because you have more exposure. You
And more compliance, right? I mean, we're talking about going into the clinic every single month to be able to get your monthly protection from RSV. And now we have a one-time injection. And we actually just came out with really good data. I'll send you the link, but you'll see really good data on how it's prevented so many hospitalizations. So we have clear data showing how effective it is.
That's awesome.
And one thing I do want to say that, because I feel like this is anti-vax, talk, but Beyfortus is not a new vaccine. It is a new vaccine for the US but it's just because it's been approved. There's other places in the world that have been using Beyfortus for a long time. Okay, so Beyfortus is not new, but it is new to the US as of 2023. So I feel that there are a lot of parents who are like, new vaccine, not gonna risk like a new vaccine. And it's just like, it's not a new vaccine. It's been around for a while. It just got approved to be used in the US.
And things
in
take a while to get approved here.
Yes, I'm like, so no, do not freak out. It is not, everyone's traumatized by COVID, right?
Yeah.
So, but no, it is not a new vaccine. I just wanted to kind of say that because a lot of people think that it is a brand new, like manufactured vaccine, and it's not. There's other parts of the world that have been using it for a very long time. It's just new to us in 2023. It did receive approval through the FDA.
Yeah. Anyway, it could protect a baby for the whole season. So this is, it's game changer.
Yeah.
So the FDA approved this one, Beyfortus, for all infants entering their first RSV season up to 8 months old, and some children up to 20.
Infants.
All infants, yes.
Yes. So
all
that's really good because again, the other one, which was Synagis, was only approved for kids that were high risk.
Yeah.
So we have a vaccine for all babies now.
Yeah.
Which is great.
Exactly. And then again, it's up to 8 months old, and then some children up to 24 months who remain at that high risk. And then, like she had mentioned, trials showed about 70 to 75% fewer medically attended RSV infections versus placebo. Now we're going to go ahead and jump over to maternal RSV vaccine because moms need to be protected too in order for the baby to be protected.
Yes, exactly. So if the mom has the vaccine, we will see those antibodies for the baby.
Yeah. So in 2023, the FDA approved an RSV vaccine for use in the third trimester of pregnancy. Pfizer's
Abrysvo. Yeah.
There. The shot includes antibodies in the mother that cross the placenta, protecting the baby for about 3 to 6 months. That's pretty cool.
Yes. So If you received Abrysvo or the RSV vaccine during pregnancy, we usually want it at least 2 weeks prior to giving birth so that you can actually have that crossover. So if you had that, then your child does not need the RSV vaccine.
That's really
if that
cool.
makes sense. Okay. So if you did not get it or you got it way too late, like let's say you got the immunization and then like 3 days later you gave birth,
Right.
we don't see that crossover. So we do recommend it.
Right, right.
But if you got it and you have enough time, then your baby actually won't need before this.
That's really cool. All right. So then the CDC recommends, the CDC recommends vaccination in late pregnancy, like she had just said, to guard the newborn. And then now vaccines for older adults. In 2023, the FDA approved the first RSV vaccine for older adults, GSK's
Arexvy.
and Pfizer's, and a Pfizer vaccine. Arexvy, right?
Yeah, Arexvy.
Okay, is approved for people 60 and older, and a Pfizer or Moderna vaccine is approved for 60 and older. These shots protect seniors from RSV lower respiratory disease, which is that dangerous one that we got to be careful for. Early data show that about 70 to 80% of efficacy against RSV illness. That's pretty big, you know.
Yes.
The CDC's advisory committee recommends 1 dose for adults 75 and older and for those 50 to 74 with risk factors, given in the fall just before RSV season. As of 2025, so very recent, 2 RSV vaccines have FDA approval for adults 18 to 49 at risk. ACIP, it's still reviewing guidance for younger adults. We now have multiple tools against RSV in 2025, given all of these. The WHO notes 2 licensed products for infants, a maternal vaccine and a long-acting antibody, and 3 RSV vaccines for older and high-risk adults. The CDC states infant RSV antibodies are highly effective in preventing RSV-associated hospitalization. That's pretty awesome.
Yeah.
How medicine continues to create these really cool new medications, you know?
Yeah, and I'm really happy that we have finally this FDA approval for this.
Beyfortus.
Yeah, for the Beyfortus, it's honestly been a game changer in peds, and that's why I'm always pushing. And it's crazy. I had to figure out I have to code it differently to have insurances approve it.
Insurances are freaking.
It's terrible.
nightmare.
So now jumping into the epidemiology, RSV is a major public health burden. Globally, it causes millions of respiratory infections. The WHO estimates that RSV can lead to about maybe 3.6 million hospitalizations and at least 100,000 losses of life each year in children under 5. 3.6 million hospitalizations, 100K losses of life in children under 5. Mostly low-income countries. Again, we talk about that supportive care, access to healthcare,
To those vaccines.
to those access to vaccines. So again, we are blessed to be able to have that.
Yeah.
Now, another source reports RSV affects 33 million children under the age of 5 annually worldwide, with over 3 million hospitalizations in rich countries like the US. Far fewer infants lose their lives to RSV, but the strain on healthcare is large. Each RSV season in the US used to cause roughly 2.1 million outpatient visits among children under the age of 5. So 58,000 to 80,000 hospitalizations for kids under the age of 5. 110,000 to 180,000 hospitalizations among adults 50 and older. And about 60,000 to 120,000 hospitalizations and 6,000 to 10,000 losses of life in adults over the age of 65 and older. Now, these are just really massive numbers, right? Now, numbers obviously will vary year to year. And after COVID-19 measures were lifted, many countries saw kind of an unusually heavy 2021 to 2022 RSV season. Again, a lot of those COVID restrictions were lifted.
Yep.
So in 2022 to 2023, the RSV season started early and overlapped with flu and COVID peaks. And this is why a lot of the time when we talk about flu and cold season, we kind of group everything together. Flu, COVID, RSV. Now, that caused overloading in hospitals worldwide. So
I remember when that happened. Yeah.
yeah. Again, we have resources, right? But we can't just magically make things appear when we weren't expected or prepared for that.
Exactly.
Now, seasonality is predictable in temperate regions, winter peaks, and about a 5-month season on average. CDC data from before COVID, 2014 to 2017, showed US RSV seasons usually start mid-fall and end by the spring. Some areas like Florida or Hawaii have longer seasons, basically fading kind of into April to May. Because RSV is so common, repeated infections occur over a lifetime. So babies who recover often get RSV again as toddlers. That's another thing that parents ask me. They said, but they had RSV last time. And then I said, it can happen again.
Yep.
That's with every virus. Each infection tends to be milder after the first, right? Because you do have those antibodies, you create that memory. But by school age, many kids have had RSV multiple times. Each winter, RSV still takes a toll. Now, pediatric hospitals do fill up with bronchiolitis, like I was saying, and pneumonia cases. And again, nursing homes as well. They see clusters of these pneumonias.
It's scary, especially if it enters and it starts circulating in a nursing home. That's really scary stuff.
Yeah.
Recent news and developments, other than the latest vaccine and all that good stuff. First RSV vaccines for humans in 2023, the FDA approved the first RSV vaccines for older adults. On May 3rd, 2023, the FDA announced
RSV, GSK.
Yeah, for people 60 and older, shortly after a Pfizer vaccine was also approved. These vaccines marked a major shift. Trials showed single doses cut the risk of RSV lower respiratory disease by roughly 80% in the first year.
Yep.
That's incredible. Real-world data from 2023 to 2024 season confirmed strong effectiveness.
And that's that study that we posted before.
Yeah. The CDC now recommends a one-time RSV vaccine for older adults, as noted above. So that's fantastic. And then talking about that maternal RSV vaccine in 2023, the FDA's advisory committee reviewed a vaccine for late pregnancy from Pfizer. They concluded vaccinating in late pregnancy protects babies in their first months through the maternal antibodies. The ACIP recommended it in 2023, and it is now offered to pregnant patients. And then those infant monoclonal antibodies in July 2023, the FDA approved the Beyfortus. This single-dose antibody is given to newborns or infants entering their very first RSV season, and it's designed to last the whole season. Trials showed about 75% lower RSV pneumonia or bronchiolitis. The CDC recommends that infants receive this Beyfortus unless protected by maternal vaccination. And some countries, US, UK, Spain, have begun offering these antibodies.
Yeah.
And
perfect. New CDC guidelines incorporate these tools to prevent RSV in infants, either maternal RSV vaccination or infant immunization with the long-acting RSV monoclonal antibody. Beyfortus is recommended. Most babies do not need both. We are gaining ground on RSV. Vaccines and prophylaxis have arrived for groups that previously had none. The World Health Organization and pediatric experts are calling for broad infant protection, though infant protection through maternal vaccination or nirsevimab, which is Beyfortus, because RSV burden is high. Now, fighting the misinformation, RSV is not new, like I said, or caused by vaccines. RSV was discovered in the 1950s and has been known to be that winter illness since then. Now, the recent surge in cases relates to the pandemic pattern changes, and it's not new inventions, right? Vaccines and antibodies are safe. The newly approved RSV vaccine and antibodies underwent large trials. Minor side effects, arm soreness, mild fevers can occur. I can tell you, I've been doing this since 2023. Knock on wood, never seen anything.
wow.
Nothing. And I asked every parent, hey, how did it go with the vaccine? Because it's like a first-time vaccine for them. And no, everything's fine.
Amazing.
Yep.
That's great.
So serious risks are rare. FDA and CDC continue to monitor safety issues. RSV is viral. Antibiotics do not cure it. Supportive care is the mainstay. Nebulizers or steroids usually did not help in typical cases. Vaccines do not cause RSV. RSV vaccine contains only parts of the virus or induced antibodies. They do not contain live RSV. They train the immune system to fight RSV if exposed later. Bottom line, use reputable sources, the CDC, the FDA, and the World Health Organization to provide current guidelines on RSV. ask your doctor or your pediatrician if you have questions, especially about the new vaccines or infant antibodies. Beyfortus. Ask your doctor about Beyfortus if they offer it.
Not sponsored.
And if they don't offer it, come see me. I'm just kidding.
Not sponsored, but hey, before this, we're here.
Yeah. It's a
Yeah.
great vaccine. And you know, like now that we have this new data and new research, I'm able to kind of tell that to parents, right? It's all about the communication. There's nothing more effective in communication than numbers.
Yeah.
You can see that even in like on a normal baseline communications class, they're always telling you to be as specific as possible because it really gives an idea on effectiveness.
Well,
we have
makes
those
it
numbers now.
Very, very apparent. It's clear to see it, you know,
It's
with
clear
the
to see with
numbers,
numbers,
you know? So yeah, that's RSV. If you're seeing this trend, if you've been following us and listening or watching our episodes, you've been seeing that we're doing a little bit of a trend of all these vaccines, these common vaccines that come. When we're talking about children's vaccines like the MMR vaccine, varicella.
We're covering the illness and the prevention, which is the vaccination.
Exactly. And it's covering the illness to show why it's important and why the vaccine is there in the first place. It's not just because there's a conspiracy out there to just jab
And with
you.
everything going on in this world, in the era that we are living in, it is incredibly important to remind everyone how important vaccinations are. And again, just because you survived it does not mean that someone else did not die from it. So
Exactly.
that's it.
Exactly. Yeah. Could have said it better myself. But anyway, hope you liked this episode. Let us know. I read all the comments and all that stuff. Let us know what, you know, if you've taken the vaccine, you know, or your kiddo has, or any of those things.
Or
Love
your
to hear it.
experience with RSV. Maybe
Exactly.
there's a person out there that wants to share their story about RSV.
Yeah.
And we appreciate any shared stories because that can come from a very vulnerable place.
Yes.
So yeah, but any kind of engagement, we're always happy to engage with everyone.
Yeah. And you can follow us on all forms of social media, Funny Medicine Podcast. She has her own Dr. What is it?
Dr. G Peds.
Dr. GP. You can follow
She's
her
new.
there.
Yeah. Dr. G's new.
And mine is Julz with a Z _ Kaz with a Z. And yeah, talk to us, find us there, find us everywhere. And we're here every Tuesday. So subscribe, comment, do all those lovely things. And
Follow us on our socials.
follow us on our socials and all that. And we'll see you on the next one.
Bye.